Good morning, everyone. Good morning. My name is BC Omojola. I'm with the Canadian Alliance to End Homelessness. I'm part of the board HR committee. I would like to welcome everybody to the Canadian Alliance to End Homelessness annual conference, the National Conference on Ending Homelessness. Before we start, I would like to take the land acknowledgement. Before we start, I would like to take the land acknowledgement. We would like to begin by acknowledging that the 2025 National Conference on Ending Homelessness is taking place on unceded indigenous lands. The Kanekahaka Nation is recognized as the custodians of the lands and waters on which we gather today. Teotihuacan, Montreal is historically known as a gathering place for many First Nations. Today, it is home to a diverse population of Indigenous and other peoples. We respect the continued connections with the past, the present, and future in our ongoing relationship with the Indigenous and other peoples from coast to coast. With this, I would like to tell us a bit about how the presentation will go today. We have two presenters. The first presenter will be Monica Ballantyne. I'll invite her over to come and speak to us about from surviving to leading, centering lived experience. Please help me welcome Monica Ballantyne.
So thank you. Just want to welcome everybody. First, take a moment also just to give thanks to the land and the waters that continue to sustain us and to honor our ancestors and caretakers of this territory, past, present, and future. I'm Monica Ballantyne, and I'm an Indigenous woman, a mother, and an advocate, and someone who has walked through the fire of lived experience. Here I was in active addiction, that first photo. I was homeless, again, in addiction, and I was suffering from the invisible wounds of systemic barriers. But I stand before you today not just as someone who has survived, but someone who is now leading. My journey came full circle one day. Down here, I'm sober in the Arlene Wilson Recovery Center, which is at the Silo Mission, and it's the Nest. I came full circle. I was seeking shelter, healing, and a way to rebuild. And I never imagined years later I'd be back here leading this very community. So today I serve as the Lived Experience Advisory Coordinator at Silo Mission in Winnipeg. In this role, I work to ensure those with lived experience of homelessness are not just heard, but are centered in the decisions that shape their lives. At Siloam, I've had the honor of creating space for voices like my own to help guide the housing strategy, influence programming, contribute to reconciliation, alongside my coworkers, leadership, executive team, and board members. We're working to bridge lived experience with housing and development in meaningful ways. It's about transforming systems so that the people are no longer just recipients of services, but co-designers of the solution. This presentation's about that shift, so being spoken about to being heard, from being served to serving. I'll just move in and introduce you to our council at Silo Mission. This is our Lived Experience Advisory Council that I get to coordinate at Silo Mission. And we get the honor, like I said, of just helping to center the voice of people with lived experience in our organization. So we work, the terms of the LEAC are 3 consecutive terms of 3 years per term, meaning that each council member can be on our term for 9 years, so they're able to see whole projects out, hopefully. We run off a mandate, a terms of reference that they helped me co-develop, and so lived experience really just means having firsthand experience of poverty, homelessness, addiction, mental health challenges, and systemic marginalizations. It's not about theory, it's not about statistics, it's about real life. People with lived experience bring an expertise that cannot be taught in a classroom. Yeah, so now I'm gonna jump into a video that we have. It's about the silo mission and about our council. I'll let you guys watch this.
You have 1 new message and 6 saved messages. Press P to play the first message. Today, 7:24 p.m.
I also put up bed 67. I always have my bed saved. I don't know if I might make it there, but I'm making my way over there right now. Okay?
I know that this place is a connecting point between the fortunate and the less fortunate. That's how I see it.
Good to see you guys. You made it.
You made it.
You made it. Okay, do you want to put your gloves? This one?
Yeah.
You want to follow me? This side peeling potatoes. We're not cutting them right now.
I see some days the best of humanity, sometimes the worst of humanity. And I see them caring people who try to care and look after people, and then the people who are having the worst day in their life. You know, so it's a window of life. Doesn't matter who and what you are. Everybody's got to eat, and if you come here often enough, I start trying to communicate with people. People I talk to, try and encourage.
I was homeless twice. The first time I was at the Salvation Army, and I had heard about this place. I didn't exactly know how it worked though. So here I kind of got the feeling that I could work my way out of it. One thing led to another, and things really kind of improved in a lot of ways. There was a lot of wraparounds. That's what I think was very key.
The cause of homelessness is very complex. A lot of times it's not cut and dry as, oh, they don't want to work, or they're lazy, or they have some other issue. Often it is a number of issues that are coming together to coalesce into a point where they are experiencing homelessness. And even being on the street alone is very mentally, emotionally, and physically taxing. And it's very easy to fall into between the cracks and get involved with addictions to soothe, the pain and just to make it bearable. You don't know what's going on, right? There's different people that, you don't know if you're going to get, stuff stolen from you, but you get to know that the people here are very, they're very respectful. Like, people that have the least seem to give the most. It's almost like a tight-knit community. Once you get, introduced here, you stay around longer than, a month or so. You get to know the people here, and it becomes very, very welcoming.
Because we don't see them as homeless people. They are just suffering from experiencing homelessness. Because when you start saying they are homeless, you are talking them down. We need to encourage them, make them feel like this place is also home.
So I'm Monica Valentine. I'm the Lived Experience Advisory Coordinator here at Silent Mission. So we're here to try to make sure that our programs, our policies, our staff even are fully equipped with the tools they need to meet people where they're at. The LEAC, our Lived Experience Advisory Council, is not just the consultation that a lot of my sector partners are doing, and we've moved into leadership. So I myself sit with the leadership and the executive teams. So at a typical monthly LEAC meeting, we start off with a meal and a smudge and just saying hello. And then we always have an agenda, whether that was items that I'm bringing forward for the council or the executive team or just our housing strategy working team. Yeah, so we just work on whatever is sent our way, usually higher level stuff, not direct programming stuff, but like policies and like who's gonna go into each building, even before we have the properties. Because we've lived it, so we know what works, we know what doesn't, and we know what barriers really contributed to us staying in that cycle of chronic homelessness. So being housed, unhoused, right? And so we want to help everyone learn how to do it in a good way so we can eventually end chronic homelessness. All right, thank you. So that is a very short clip of a documentary that we're actually filming and hope to have maybe released in the springtime. And if anybody wants that, they can email me and I'll add you to like a list, I guess. So moving on, we're gonna jump into tokenism versus genuine inclusion. So tokenism is really just doing something because you should do it. Because it's expected or a rule, and not because you like want to do it or you feel like it's an important thing to do. So it can often look like adds people only to check a box. Voices are present but often ignored, and no real influence or change happens. Versus genuine inclusion, which is welcoming lived experts or whoever it is to the table because you want them there, because you value their expertise. And so it'll often look like voices are centered and valued, input shapes real decision, and power and responsibilities are shared. Okay, so I'm gonna move on to 3 impactful tips for centering lived experience. This is only 3 of them, there's many more. So the first one, of course, is co-leadership, not consultation. So sorry, I lost my train of thought. So too often lived experts are consulted. At Silo Mission, we're moving towards co-leadership, where lived experts sit at the table from the very beginning, helping to shape the strategy and direction. So it's really about moving from tokenism to genuine inclusion. Tip number 2, fair compensation and support. So lived experience deserves fair honorarium, proper support and recognition as professional expertise. And then co-designing from day one. Programs and strategies often work best when lived experience voices are incorporated from the start, walking alongside, not coming in after decisions have been made, and it often leads to more solutions that are grounded, more effective, and more human. So we're gonna move on to some tools to help use those tips. So of course, creating an LEAC, which is the Lived Experience Advisory Council, or integrate people with lived experience, so PWLE, into existing teams that you already have in your workplace. Don't just ask for input, share the decision-making power. Include in strategy teams, hiring panels, and funding decisions. And then use a term of reference co-developed with your members for clarity and respect. I developed a terms of reference, but I ran it through the council and had them provide their input, as well as the mandate and other documents that I did upload, and you guys can have a look at those. So for tool number 2, the tips would be recognize lived experience as expertise and not volunteerism. Offer a fair honorarium that will cover transportation, childcare, and provide food at meetings. So Silo Mission does pay our councils a fair amount, which wouldn't cover their transportation and childcare, and then we always order a meal to share together. And then, of course, consider trauma-informed supports and emotional check-ins. So at the beginning of our council, our council's been around for 1 year now, and at the beginning of our council, I was offering one-on-one monthly check-ins for my council members. They also have my email, phone number. I'm very accessible. We've kind of moved to 2 months, and now it's just whenever they feel the need to meet with me one-on-one. We cover a lot within our meetings. We also can call in elders or whatever type of support they need for their own journey. And then tools for number 3 would be co-design models and programs and policies. I noticed the spelling error, but it was too late to fix it. And it's been driving me nuts since, but that's okay. Invite people with lived experience into the design room from day 1. Run focus groups, journey mapping, community validation. So often I have a council that we meet with, but I often will make different focus groups, and I'll go and round up people, say from our drop-in, and we pay them an honorarium or a gift card or whatever we have that day, just to get the real information and the expertise from the people that can't maybe make the meetings every month. And then avoid tokenism. People with lived experience should be co-authors of solution, not just feedback providers. So if you invite them into the room, please have them added to your documents that they provided some knowledge. Okay, so before I share my calls to action, I have a little bit of an interactive part. So this is where I'm just gonna ask, I didn't catch your name. Yeah, sorry? Mercy? Okay, so I'm just gonna ask her to come around with the mic if anybody wants to share. So I just have 2 questions. Where do you see lived experience voices missing or underrepresented in your workplace or organization? And what about the bigger systems? So like government, justice, bigger systems. And then while you're sharing, just notice if there's any patterns or anything you're surprised by, if anybody wants to share. Thank you. So she said executive leadership. Okay. I'll save you the trip. Yeah, and yeah.
Hi, thank you for this. I'm Bryony Halpin from the City of Toronto, and we have a lived experience advisory group, and we're trying to follow all of your hot tips here as best we can, but I think what we struggle with is some of the decision making is beyond my control. I'm a manager and I work very closely with our league. We call them league, but in terms of we're just about to embark on co-developing an access plan with our league, and it's like I can't share power or decision making fully because I work in this giant bureaucracy. So I think that's something that I'm grappling with.
Yeah, I would agree.
Thank you.
Okay, anybody else feel like sharing? No, that's okay. So, oh yeah, I see another hand back there. White shirt and glasses.
Just a quick note. I'm from Halifax. My name is Lindsay, person with lived experience. I feel like we probably all can relate to this, but in Halifax specifically, our government has 0 lived experience representatives. And actually, this past year, the person who is, I guess, the lead of unhoused folks, I don't know her actual title, said that people are just camping, as in they're doing it for enjoyment. So I'm sure many of us from different provinces can relate to that. I think it's a huge, huge issue. Yeah, that's all I got to say about that, but yeah.
Thank you. I appreciate that. Okay, anybody else? Oh, yeah. There was someone behind you.
Hi, my name's Ami. I'm Inuit, and I'm originally born and raised in Punatup, Baffin Island. That's up Nunavut. I live in Guelph, Ontario. Because of my health problems, I can't handle the cold anymore, so I have to. We have an advisory group and a planning group, and we really understood that we needed a planning group, but they needed the experience group that we all lived through. I'm in a lived experience myself, and it was super hard, but I had to do it myself. All my support was there, but yet I did it myself. With my support help to help me. They help others to get the attention that who I was as a homeless person. And there was no one, the government, any association, or any program couldn't do anything because of the red tape. They could just hear, but they could care, but they couldn't do anything. So we had to kind of come up with something with the Wellington County to get a planning committee. And they couldn't do anything unless there was a lived experience group. So we became a lived experience advisory group. And based on that, with our lived experience and they had planning committee had no idea how to plan for the people that live experience and how to be taken care for by health and housing. And like my goal is, once you are homeless and you are found, I want that homeless person to be cared for to the rest of their life. Have an outreach person for them, education, healthcare, everything. Because every one of you could be homeless. Your child could be homeless. Right now, you could be raising a little meth head child that's going to be grown up. Someday, they're going to be homeless. You don't seem to care. Nobody seems to care. We don't want to care because we don't want to see them. If Canada was supposed to be Canada, and they told the government told the Inuit, if you want to be a settlement, you're going to be house, promise, house for life. And here we are dealing with homeless people. I don't think Canada is fit to be a government. I don't think they're supposed to be here. A colonist is supposed to not have a homeless person. Like if there's like this, it got really serious in Wellington County. Like with the government, the homeless people, the associations, the society. But we all had to learn to work together and listen to one another. And we had to learn to accept the homeless person. If they don't want to be cared for, we just show them the caring, that we love them.
Thank you.
We do love them.
Thank you very much.
Yes, thank you. Okay. Yeah, and then I guess just to keep a thought in mind, just what could ending chronic homelessness look like if we did invite more lived experts to the table? Yeah, so I guess my calls to action would really be to build a People with Lived Living Experience Council, revise your engagement practices, and co-create with community. The co-create with community, I will say, does not have to be like a council. Again, it could be simple, what I do, make a little survey, go around collecting people and do it. And you got knowledge, and then you honor them in a good way, of course. And yeah, leadership grows where it's nurtured, just like the heartberry. So now what I'm gonna do is I just wanna leave you with an image. And on one side of this image is a bridge. It's our survival stories of homelessness, addiction, trauma, and systems that have failed us. On the other side is what we're building together. Homes, healing, equity, and justice. Lived experience isn't the problem we're trying to fix. It's the bridge we must walk along to reach lasting solutions. Let's keep walking, let's keep building, and let's let people with lived experience at least help lead the way. And thank you. And yeah. So these are my contact details if anybody wants to contact me. I really did develop this entire role almost, I want to say, and everything that the council does. So anybody that wants to collaborate and make their own council is free to reach out to me. Yeah, and I have a handout if anybody wants it. I'll just be at the table with it. If not, everything's uploaded, of course. Thank you.
Thank you. Thank you very much.
I guess any questions? Am I supposed to leave room for questions?
It's
We're
at
good.
the end.
Okay.
Yeah, so, thank you very much, Monica Valentine, for sharing your experiences, and for people participating as well. Still talking about lived experience from shame to strength in housing and health. I would like to call on Larson from the University of Calgary to take the second presentation. Thank you. Sorry once again.
I have an USB cable as well.
That's Larson. I saw Larson. Larson. Is that it?
Larson one. Yeah, right here. Sorry about that.
So we'll have an opportunity to take questions and answers after this session. Thank you.
Wow, I really wish I had gone first. That was, it's hard to follow up that presentation by Monica. That was excellent. Sorry, just getting the gum in my mouth so I don't dry out. Okay. Yeah, really happy to see everyone here. This is incredible. This whole room is filled. I'm, yeah, really happy to be able to talk on this topic. And yeah, to just introduce myself, my name is Mal Larson. I was a master's student at the University of Calgary. I just defended my thesis in June, and I'm here to talk about. Here to talk about my thesis project, which is on shame and the lived experience of homelessness and diabetes. So I'm going to try and keep my presentation around 30 minutes. So we have about 15 minutes for questions. But I don't know, if somebody wants to keep track of the time, you know what, I'll do it right now. Okay. Yeah, first off, the University of Calgary, located in the heart of southern Alberta, both acknowledges and pays tribute to the traditional territories of the peoples of Treaty 7, which include the Blackfoot Confederacy, comprised of the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina First Nations, and the Stoney Nakoda, including Chiniki, Bearspaw, and Goodstoney First Nations. The City of Calgary is also home to the Métis Nation of Alberta, District 5 and 6. So just to let you in on a bit of my background, I experienced homelessness for about a year, from 2018 to 2019. These pictures on the screen are of some of the shelters I stayed in Toronto. I was also diagnosed with type 2 diabetes in my early 30s. For those who don't know, diabetes is a chronic disease where the body has difficulty producing insulin on its own. Insulin is a hormone that regulates the amount of glucose in the blood. Both high and low blood glucose levels can have a negative impact on one's health. Yeah, so basically diabetes just makes life harder in general. And you can imagine, when you're dealing with homelessness as well, it just adds to the hardships, right? All right, there we go. So in January of 2019, I joined the Clients with Diabetes Action Committee, or the TCDAC. Community members in the TCDAC, there were 7 at the time, all had experienced homelessness while living with diabetes. And this was a community-based participatory research group, and this type of research involves academics and community members sharing power. So yeah, it sounds like similar to Monica's lived experience group. I mean, the TCDAC, basically we shared power in that we decided the focus of our research and the type of, like the methods that we wanted to use in our research. So we decided to basically do a photo voice project related to the food situation and the shelters that we had stayed at. So yeah, you can see there's a picture of one of the photo exhibits that we did. Yeah, we did photo exhibits all over, including I think CAEH back in 2019, back before COVID. So yeah. In April 2021, the Calgary Diabetes Advocacy Committee, or CDAC, was formed. Again, all group members have lived experience of homelessness and diabetes. Since its creation, the CDAC has completed several research projects, including the filming of a short film entitled Low, that illustrates the difficulty of dealing with type 1 diabetes in a homeless shelter. Yeah, also, I think Low appeared at CEH a couple of years ago. Yeah, so why am I talking about these topics? Why is it important to talk about homelessness, diabetes, and shame? So the stigma associated with diabetes and homelessness can lead to feelings of shame. Shame can negatively impact one's health and well-being in many ways, not just psychologically, but physically as well. It's been proven in different studies that shame can increase physical maladies in the body. And yeah, no study has examined the shame of people with lived experience of homelessness and diabetes. Like, studies have been done on different, like both diabetes and homelessness, the shame involved in those, but not together. So this is the first study of its kind. Okay, so these are the two research questions that I wanted to answer. The first is, what is the experience of shame like for people with lived experience of homelessness and diabetes? And what is the perceived impact of certain coping strategies on an individual's ability to be resilient to shame? Yeah, so the focus was to answer these two research questions. Yeah, so just defining what even is shame. And I think shame is a pretty difficult concept to define. I spent a lot of time in my thesis just trying to understand what it was. And it's particularly hard to nail down because it's confused with other concepts like guilt and embarrassment. And really what's on screen right now is, I think, the best definition I could find of shame, and that is the belief that one is fundamentally flawed and unworthy of acceptance. And yeah, this is this is kind of paraphrased from Brené Brown's Shame Resilience Theory paper. I don't know if anyone's familiar with Brené Brown, but she talks a lot about shame and how to develop resilience towards it. So this study is kind of based on some of her teachings. So for our study, we interviewed 7 individuals from in and around the downtown Calgary area. All participants had diabetes and were either currently experiencing homelessness or had experienced homelessness in the past. Interviews began in January 2024 and ended in April 2024. Study participants completed 3 separate semi-structured interviews on the following topics. Yeah, so the first one was shame related to diabetes. The second one was shame related to homelessness. And third one was coping with shame and ways of developing shame resilience. A CDAC member was present during the majority of the interviews. CDAC members took notes, asked follow-up questions, and debriefed with me afterwards about their thoughts and what was shared by the participant. Yeah, CDAC members were a huge help with this project, including the data analysis piece. If a CDAC member attended an interview, we discussed what the participant had shared afterwards. At group meetings, the study team and CDAC co-researchers read abridged transcripts aloud and discussed them. Yeah, this was really cool. It's like, what I would do is I would print out copies of the interview transcripts, and they had to be abridged because there was no way, like some of these interviews were 2 hours and 45 minutes long. So we had to cut them down significantly to be able to discuss them in the group meetings, which were about an hour and a half to 2 hours. So yeah, I would cut them down, kind of focus on the parts that I thought related to shame, and then we would discuss them in the group and just get everyone's feedback. And that was tremendously useful right? Like otherwise I would just be analyzing the data on my own. But being able to use the CDAC was tremendously useful, getting different perspectives. So like I said, discussions focused on interpreting how or / why a participant felt shame based on what they had shared. Yeah, and again, the CDAC perspective was immensely helpful. So we found 4 main themes related to shame for people with lived experience of homelessness and diabetes. And I think that shame comes from being vulnerable, needing to rely on inadequate support systems, being isolated and lonely, and experiencing profound and or unexpected loss. Okay, I'll go over some of our quotes and findings from these categories. So the first category is vulnerability, and the quote is, "Everything's stolen at least once at the homeless shelter. I've had my clothes, everything that I own stolen. I got beat up." Yeah, so here's clearly a case of somebody not having or being physically vulnerable to other people. But there's many other examples of vulnerability, especially like emotional vulnerability. People are vulnerable to their own kind of negative self-thoughts. That was tremendously evident in these interviews. Right? A lot of guilt for past actions, right? A lot of shame just for becoming homeless. I think that was very clear for some people. Right? So I think vulnerability was quite a robust category. So isolation and loneliness is next. And the quote is, "When I got fired from my job, I thought no one didn't want me. I couldn't turn to the family because I wasn't talking to them for years and years." So again, I think isolation and loneliness is very common, obviously, when you become homeless. Just being homeless the fact that you are homeless kind of shows that your social system is not there, right? That you don't have people to kind of support you. So I think, isolation and loneliness is pretty much goes hand in hand with homelessness. In most cases, actually. You know what, maybe I'll circle back to that because some people, like one of our participants found like a really strong support system with her peers on the street, right? And that was quite interesting, but I can talk about that later. But the loss of social and family connection that often accompanies homelessness left participants with a deep feeling of isolation and loneliness. Yeah, so it's like they're socially disconnected, but then they were also disconnected because in some cases, like they thought that other people couldn't empathize with their lived experience. For example, there was one participant who said like she broke off contact with her therapist because she said that her therapist didn't have diabetes and henceforth she wouldn't be able to understand her life because she had diabetes and it was such a big part of her life. So yeah, that lack of experiential overlap really kind of prevented that connection. All right, the next category is profound and or unexpected loss. And this quote's very powerful, I think. "It is very shameful when you were somebody before and now you are nobody." Yeah, this quote is from an individual who had quite a prestigious job before becoming unhoused. And it's like, kind of to paraphrase what they said, it's like they went from having this important job to then being a homeless person. Right, and I think that switch in identity, like from having a really valuable or valued identity to having a really devalued identity is tremendously traumatic, right? So it causes this person lots of shame for sure. Yeah, and then there's so much loss, right, in regards to diabetes and homelessness. Loss of health. With homelessness, you're losing your home, money. Tremendous loss in all categories. All right, the fourth category is inadequate support systems. I'll just read the quote first. I'll give some backstory to it in a second, but the quote is, "They said, 'How are you supposed to take care of a child when you aren't taking care of yourself?' But the thing is, I didn't have the right tools to take care of myself." So this is a quote from an individual, a lady, who was originally diagnosed with type 2 diabetes when she was younger, and she I think she had a 2-year-old child at the time, and eventually was taken away by Children Aid Services because something like erratic behavior. I forget what exactly she was saying, but basically it turns out that she had type 1 diabetes and it was misdiagnosed originally. And basically that can really lead to erratic behaviors if your blood sugars are all over the place, right? So then she eventually got her child taken away, as I said. So it's like, that's a good example, I think, of an inadequate support system, right? The doctor made a mistake and it cost her severely, I would say. Yeah. So it's like, when you're a person who relies on these support systems so deeply, right, any kind of mistake can be crushing, right, for you. Yeah, so it's very important that these support systems work as intended. All right, so here's all the categories together. So for the study, I wanted to understand what the essence of shame is like for those we interviewed. In trying to figure this out, I asked myself, is there one thing present in all 4 categories? So the answer I came up with is constrained agency. All right, so what does that mean? Constrained agency, I'll read the quote first. You have to eat properly and you have to check your blood sugars regularly. But when you're homeless, all the meals at the shelters are way too high in starch. Either you go hungry or you eat what's not proper for you. Yeah, I think this is a great example of constrained agency. I mean, you just don't have choice, right? You don't have choice as a person experiencing homelessness. You don't have choice in so many different areas. This is just an example of not having choice of food, right? But it's like you also don't have choice of when you eat, right? You don't have choice of when you get your medications in some case, which if you watch the movie Low, because this guy didn't get his medications at the right time, he ended up going into like diabetic seizure from low blood sugar, right? So again, just not having choice, not having freedom can have disastrous consequences, and basically that powerlessness leads to just, I think it's a central feature with shame for this population. Yeah. Yeah. So again, in this Venn diagram, I attempt to show how examples of constrained agency exist in all 4 main categories of shame. So all items within the center circle relate to constrained agency in some way. Because constrained agency is present in the 4 main categories, I believe constrained agency is the essence of shame for our participants. Okay, so reach for question 2. Yes, we talked about shame. Now I'm interested in how do people cope with this negative feeling / belief. It's funny, actually. I think about it. I actually did 2 projects, right? Like I did a project on shame, and then I did a project on coping. So it was my thesis was like 300 pages long, and I joked to my professor, my supervisor. I'm like, just 1 project would have been fine. That would have been okay. But yeah, so I did 2. So that's the second one. So what is the perceived impact of coping strategies? Yeah, so I think most people have heard of the terms like maladaptive coping or adaptive coping. I think those terms, I believe they're kind of outmoded nowadays. I think the term adaptive can apply to even things like drug use in some cases. Like people might use drugs to kind of deal with trauma, right? Something like that. So I think that the terminology is changing. So I think these categories are a little more precise in regards to coping. So the first is active emotional coping. And these are efforts taken to directly alter one's emotional response to a stressor. For example, venting, positive reframing, humor, and acceptance. Avoidant emotional coping. So these are efforts taken to avoid thinking about a stressor at all. Right, just avoid thinking about it. So examples are self-distraction, denial, behavioral disengagement, substance use, etc. And the last one is problem-focused coping. And that's taking direct action to eliminate or reduce the impact of a stressor. For example, making and following a budget to save money, exercising to improve health, etc. Yeah, so there's just some quick examples. I'm going to go through a few examples of coping strategies the participants in the study used, but this is not going to be a comprehensive list. I'm only going to go through 6, but 97 distinct coping strategies were observed in the study. Yeah, so I couldn't go through them all. So the first one in active emotional coping is seeing the humor in challenging situations. I'll just read what this person said. I'm a really big advocate of people that can be in a really rough situation and just make it seem so stable and so peaceful. So I strive to be like that. What else am I going to do? I'm going to cry? No one's going to give a shit. So you might as well try and make people laugh, right? Including yourself. Yeah. So I think humor is so important. there was a lot of humor, there was a lot of laughter during these interviews. Even sorry, I just realized that I was laughing when you couldn't find your USB key. It's like nervousness, right? Like it's just the nervous laughter. I mean, this one time, this guy was talking about an unsuccessful suicide attempt, but he was making it into a joke. Like he was like, oh, I tried to crash my car and kill myself, but I was so used to wearing a seatbelt that like the seatbelt saved my life. And I'm just, like at first, I don't know what to say. And then like after like 5 seconds, I just crack up. But it's like, I don't know, what are you gonna do? But he was laughing too. And it's like, I think that's very powerful, right? Like I think you can kind of reframe like a tragic or traumatic situation by using humor, right? Tremendously impactful. Again, also humor, like shared laughter, right? That shared laughter that we just experienced in the room, like that shows unity. That shows, understanding amongst people. So I think that's very powerful, right? Second example of active emotional coping is belief in religion or spiritual principles. So the quote is, I go to chapel and look at the cross and think about Jesus, the time that he was around, what he went through. That gives me more hope that he will still be considering my prayers of help. Yeah, so again, belief in religion or spiritual principles. The majority of participants believed in God or some kind of spiritual principles. And this helped basically protect them from shame in a variety of ways. I think one of the ways was it gave people hope, like people that had belief in the afterlife, like thought that they would, think the scales would be balanced when they passed, and that they would receive kind of their ultimate reward in heaven. And so I think it gave them hope. It gave them a lot of hope, and I think that's evident in this quote. Like this person is like demonstrating hope that God will save him now. Yeah, and I think that kind of helps with the coping. All right, going into the avoidant emotional coping, and the first big category is using addictive substances. And the quote is, I stole from my mom and dad, that got inside me. I wouldn't take money for drinking and gambling, and guilt, and built up, and built up, and built up. The only way I could relieve it was drinking again. Yeah, this is very common. Only, 6 out of the 7 participants in the study had extensive use of addictive substances. And it's very common, right? Again, it's a coping strategy to just kind of get outside of your own mind, I think, or numb yourself, or just experience bliss from the drug, that you can't kind of worry about the stressor. So again, very common, but I would say, not one of the most effective ways of handling stress, I think, even reported by participants. I'll get into that later. All right, another avoidant emotional coping strategy was, this is an interesting one, emotional detachment. And this person said, I think it's really important to have a good friend, but it's not an everyday kind of thing, because I think you end up in trouble that way. After a while, you know too much about each other, and 6 months you want to kill each other. I think this is very interesting, right? This person is describing basically the danger that comes from getting to know somebody, emotional closeness. And it's really tragic, right? To think that people learn to kind of keep other people at arm's length because they're just afraid of being vulnerable. And I don't know, it's what are you gonna do? There's it's inherently risky to, be in a relationship where you care about somebody, I think. And because you could be hurt, but I don't know, what are your options? You just become a hermit, you live by yourself. So I think this person had experienced a lot of pain, right, from other people. In fact, he talked about losing contact with his son and daughter. And so there is an inherent danger or leading or vulnerability from just forming these emotional connections. Okay, getting to problem-focused coping. The first one is forming authentic connections. As I understand it, an authentic connection exists when people feel they can communicate truthfully and are able to be vulnerable with each other. I'll just read the quote first. Going and talking to someone, going to my diabetic group, that helps. just talking to people that are going through the same thing you're going through. Yeah, and I think, yeah, Monica, it sounds like your group like really has that authentic connection. And I think that's really formed in the CDAC as well. And we really tried to have that authentic connection in these interviews as well too. I mean, I was sharing a lot about my own history of homelessness and the issues that I faced, trying to kind of demonstrate my own vulnerability during these interviews so that the participants would feel, comfortable sharing theirs as well. And I think that really helped. That really, showing vulnerability, showing kind of similar lived experience. I think that it gets people to open up and just realize that they're not alone, and that really helps with the shame. That really kind of normalizing it. Yeah, like conferences like this are amazing for reducing shame, I think, because it's like you see other people kind of with similar stories to your own, and you realize that you're not alone, right? So normalizes things really helps. And the last one, problem-focused coping is helping others. And this quote is, I'm doing it, helping others, because I want to, and because I can, and because, well, it's the correct thing to do. And I think this is really powerful. Again, this quote, just this idea that I'm doing it because I want to, right? Helping others really demonstrates agency, right? It demonstrates the fact that you can help others, that you can do something, right? I think that's tremendous. And I think this was actually, the best coping strategy, like the most powerful one for reducing shame for other people, for the people in our study. So yeah, this is tremendously powerful. And just getting it, I think helping others, right? You get outside yourself, you kind of not focusing on your own problems, and then you realize that you can even use the problems that you've experienced in the past to help others, right? You can use your own lived experience, so very powerful. All right, I'm coming to the end, the conclusion. So this is really interesting. No study participant expressed that they felt unworthy of being accepted. So I don't know if you remember, the definition of shame is the belief that you're flawed and therefore unworthy of acceptance. But again, I couldn't find a single example in any of the interviews of anybody expressing that they didn't feel worthy of being accepted. I mean, people talked about like feeling flawed, feeling like they had made tons of mistakes in the past, but nobody believed that they were irredeemable, that they couldn't be forgiven. So I think that's really interesting, and I'm actually kind of interested in why you guys might think that is. And I have my own ideas too, but maybe we'll get to it in that question period. And regards to the coping strategies, active emotional coping strategies appear to decrease shame and increase shame resilience. Again, examples of those are using humor and religion. Avoidant emotional coping strategies appear to increase shame and decrease shame resilience. So again, examples of those are emotional detachment and use of addictive substances. And the last one, problem-focused coping strategies appear to significantly decrease shame and increase shame resilience. Again, yeah, like I said, helping others, the biggest category for reducing shame. Yeah, so the takeaways from the study. I think trauma-informed practices can significantly benefit people with lived experience of homelessness and diabetes. Yeah, as it could be argued that diabetes and homelessness result in a kind of trauma, right? For sure. And the utilization of trauma-informed practices could significantly benefit these people. And by developing trauma-informed care, professionals and shelter staff can offer more flexible and personalized service for this population. Also, increasing one's sense of agency has a protective effect against shame. Again, so I think it's important, like if you're a service provider, in a shelter or something, I think it's important to try and give your clients as much agency as possible. An example, like in regards to somebody with diabetes, it would be good if you could let people have like their insulin pens on them. And I know that there's some kind of restrictions about that in certain shelters, because it's like, I don't know, insulin could be used as a weapon, and it could, you could kill somebody with insulin. But it's like, I guess you could kill somebody with anything? So I'm not exactly sure why it's just off limits. I mean, it's a big problem if you can't get your insulin in time. Like again, as we showed in that movie Low, right? So it's like, anyways, whatever you can do to kind of give people agency, I think is tremendously important for reducing shame. And lastly, connecting with people with similar lived experience can greatly reduce shame. Yeah, it's like I said, conferences like this, yeah, like Monica's group, like the CDAC, I think just connecting with people with, like, there's some overlap in your stories really shows you that you're not alone, normalizes things, you're able to talk about it, and you're able to get support, right, from people that care because they understand what it's like in some respect. And that's all I got. Thank you so much.
Thank you very much, Matt Larson, and for that presentation. So we'll take the Q&A session now. If you have questions, please raise your hands, and then I'll walk over to you with the microphone to ask your questions. Another thing I would like to mention is that after this session, we have lunch, so you should make your way to the lunch area to have an early lunch. Thank you.
Hello. Hi, thank you both for your presentations. And Matt, congrats on defending your master's thesis. It's a lot of work. My name's Sid. I'm at Wilfrid Laurier University working on a variety of research projects. I was curious, Matt, if you could talk more about the any aspects of co-design with your research methodology and just anything you felt helpful in facilitating the data analysis with your peers. And yeah.
Hello? Yeah, okay. Yeah, the co-design, that's a great question. And yeah, sorry, there was so much to talk about. Like the CDAC helped so much with this project. Like I would have needed a whole different presentation to go into all the details. But the idea for this project, the idea of like focusing on shame came from basically the original group. One of the main priorities was emotional health and stability. And that was also echoed in the Calgary group, the CDAC group. So yeah, that was kind of what got the idea going in the first place. And your other question was kind of related to, how they help with data analysis. Yeah, data, and again, like a lot of it was, to be honest, like I wish their help was more robust. Like I wish we had more time for the data analysis piece. Like we did 16 sessions, 16 group sessions with the CDAC, and I think about the first 8 of them were just kind of learning about different like shame and what it even means, and also data analysis practices. And then the last sessions were the actual data analysis, where we would discuss the transcripts in the group and get ideas. So they also took transcripts home as homework to kind of do independent coding, which was really useful. And then also what I did was, in regards to the data analysis, I think after I'd left Calgary for about 4 months and done the like independent data analysis, I came back and presented some of my results to the group and got their feedback on them, and there was really high degree of agreement with the themes that I had found. Yeah, so doing that check-in I think was really useful.
Hello.
Hi.
Yeah, thank you. Thank you, Matt. I just wanted to commend your research work. is there any possibility for you to share some of your recommendations following your findings? Because there are quite some vital aspects of your, focus group discussions and, data collected. So I think your recommendations will be quite of interest,
Sure. Yeah. Thank you. When you're forming a group like this, I think, I had a bunch of questions from Monica too, but a good idea when you're forming a group like this is to have a meal at the beginning of group meetings. I think that's tremendous. Just having we're talking, for my project, we were talking about shame for 2 hours straight, right, in these meetings, but we would have half an hour beforehand to just have a sandwich and have a coffee or something and relax kind of informally before we get into this heavy stuff. So I think that's really important, right? And those conversations you have before the formal meetings, those informal conversations are so important, right? To build those real connections and to build that trust and willing to be vulnerable with other people. And Dave Campbell, my supervisor, is amazing with this. He's like the best, I would say he's the best person ever to kind of, that I know of, to facilitate these groups. And I would recommend just looking up Dave Campbell and some of his work. But he's got excellent ideas for facilitating these groups. I don't know if Monica, you have some great ideas too.
Okay. The question, sorry. Just so I'm clear, the question was about facilitating like lived experience councils? Or more or less Matt's findings?
About thank you. The aspect of food and choices, right? And the whole other significant, points. There are a lot of things going on in my head, so I'm trying to focus and not talk for too long. So, for instance, on that aspect of his presentation, I am curious to know this amazing research. What recommendation, Matt? I want to hear so that I can adopt that and bring it home to my team for a chat.
So for policy, in shelters.
Exactly.
Okay.
Yeah.
I mean, I don't. I wish I had a better answer. I really don't know. I don't know what could change, how to change. Really, I'm a qualitative researcher. I'm about other people's stories, but it's changing on a grand scheme. I'm not sure how to facilitate that. I was gonna ask you guys actually, what do we do? How do we facilitate change? How do we make it so people can have their medications, including insulin, on them? I don't know. There's barriers to that. You guys know, because I don't, right? And I wish I had a better answer, right? All I can say is that. What's that?
I can jump in.
Yeah, jump in.
I was just going to say for that, I would say again, just encouraging organizations to incorporate people with lived experience at the policy decision table of the organizations.
Thanks. You know what? I'm just remembering you had a question earlier about where we need to see more people with lived experience in positions, and I was going to answer everywhere. We need lived experience people in every kind of sector. Yeah.
Yeah, we do.
Yeah.
Thanks so much to you both. It's such a great first session. Feel so lucky to be here. I'm down in the back. Monica, I had a question. Hello, I have a question for you. You mentioned at the start about a staff circle on lived expertise, and I think in our organization we're trying to recognize we already have tons of folks with lived expertise working in our staff teams, and how do we uplift that so that knowledge is valued the same way as a social work degree or something else that somebody might have. So can you speak to that circle and what that looks like in the staff circle piece specifically?
So the staff circle that we did start at Silo Mission is still fairly new. I just did a all staff email saying, hey, if you self-identify with lived experience, come join the circle. So right now it's kind of supporting other employees within our organization with lived experience. I'm sure it's going to grow to whatever it does grow to, whether it's advising Siloam on policies or whichever. But right now we're still very new at the staff circle. And then our actual council who meets monthly with me, we focus mainly on the housing strategy. And those are people with lived experience who have either exited homelessness or experiencing chronic homelessness. So maybe unsheltered, sheltered, unsheltered, right? Yeah. I think the way Siloam did it is a great way. So they hired, for me, for example, they posted for a lived experience advisory coordinator. And I think that was a good way to incorporate lived experience into an organization. I think someone coming at you, say like a director or manager without lived experience and then asking you is kind of awkward and weird, just to be honest, right? You're not sure what to share, what not to share. I've become very comfortable at Siloam. I'm pretty much an open book. But yeah, other than that, I think starting off by actually having a lived experience person, seeking out the others who also have lived experience, just makes it more authentic.
Hi, good morning. My name is Jackie Anderson, and I'm actually one of the sister organizations in Winnipeg. I'm the executive director at Ganiginichik. And so we offer shelter for women as well that are very low barrier, harm reduction focus, lived experience. And so I just wanted to share with you that I really enjoyed your presentation and emphasizing the fact how important it is that in any type of program development that you always have the voice of lived experience and community. And furthermore to that, just valuing the lived experience as well as an employee. Mm-hmm. And so knowing the organization that we operate and we work at, we all come with some form of lived experience. And so it's also important too, and I know you would agree, that sometimes you also have to manage differently. And being a little bit more understanding, creating an understanding, because we all go through our areas of, taking a step back or certain situations that are triggering you. So it's also important in your HR department to, have somebody that comes with lived experience that can kind of help, when somebody is struggling, that can identify, we're not just going to give up on them. Like, these are things that we need to support them. We also do that as well in the hiring. So safety planning, if you are somebody that's coming from lived experience, can you share with me how I can help you, when you are feeling triggered? So it's also about allowing people to be open and not carry the shame, that often, attaches to, that lived experience and not wanting to self-identify. So I just really wanted to say, thank you for sharing that. We've got to probably meet up sometime really soon. You're just down the block from us. But furthermore to that, I also just wanted to say I'm type 2 diabetic. And as you were sharing your studies and your findings and your lived experience, I just started thinking about, all of our relatives that are in encampments that either are undiagnosed and or have been diagnosed but have no access to medication, right? And so I'm wondering if, I know for me, if I get like a little cut on my finger, it takes a heck of a lot longer to heal than somebody that's not diabetic, right? And so has there been a study Canada-wide about those that are unsheltered that have had to go into hospital for further care? I know that I have one right now in Winnipeg that is in acute care as a result of her diabetes. So has there ever been any kind of studies done on that? That would be really kind of cool not cool, but I mean, an area of focus for those of us that are providing supports to unsheltered relatives, that this might be something that we need to vamp it up as well.
Oh yeah, no, that's a great. That's really great that you bring that up. The undiagnosed population of people with diabetes among people with lived experience of homelessness is massive, I think. And I think there have been some studies. I'm not like, I can't name them off, but I know that again, my supervisor Dave Campbell, he has a bus in Calgary where it's like they go around to people that are unhoused, like on the street, and they do like random testings like of A1C to see if they have diabetes, and really interesting results. Like a lot of them are undiagnosed, and he's done a lot of work with that. So again, I would look up Dave Campbell, but that's really important, right? Because what are you going to do? Like if you're undiagnosed, you don't know what's happening with your blood sugar. Right, I think. That's another thing. Like knowledge is so important to facilitate agency, right? And diabetes is a complex illness. There's a lot of shit to know about diabetes. There's a lot of like things that you've got to do to maintain it. And again, when you're dealing with homelessness, it's way harder, right? So the more that you know. But that's a great point. It's just like finding out how, like, what is the rate of undiagnosed homelessness, people with diabetes out there. Yeah, that's a good thing to look up.
Okay, hello. My name is Trina Ram, and I'm from Bigani, and so I'm from southern Alberta. I really enjoyed, Monica, what you had to say about the lived experience and how you formed, like how you came to form a group. I currently work in Lethbridge, Alberta, and I noticed a lot of our planning in regards to homelessness. Right now, that voice is being lost, and we're doing a lot of work, and that groundwork needed to be done first, because I can see where we're just going to be going around in a circle and continuously trying to. We have so many encampments, right? But also, where are their voices to say, you know what, let's help with the strategy plan so we can, stop this wheel. Like, stop this wheel. Like, right now I work with a managed alcohol program. We are supportive housing. And so with that, not a lot of people agree with it, but for me right now, we house 10 individual males. And with that, for me, I see where we bring the supports into the home. So emotionally, mentally, spiritually, all these come to the home for our guys. And right now, I'm very proud of it. Just because I've seen them on the streets, and I've seen where all these, their circle of care was neglected, and now I can see we have one with a hearing aid, we have one went to the dentist, we have one, connecting back with his community, and speaking his tongue, because in the city you don't get to speak your tongue. And then to connect them back to their family, to hear them speak their tongue. And, it gives you your heart such beautiful just to hear that. And you sense something, right? So for me, I would love to even start something like this in our own community, start getting the voice out there. But the thing I wanted to ask is that, great, I really like what you said about doing the honorariums, because we need to support our people to get to the council, right? And for that, thank you for that, because that's what I heard. That's what we lack, especially in our rural communities on our nations. We don't have that. So for me, did you do grants for that? Did you get support from your area to do honorariums?
Yeah, so I'm lucky enough that Siloam has it worked into their budget, I guess, prior to hiring a lived experience coordinator. So I guess it's just worked right into their budget, the organization, because it is very important to honor that knowledge, right? Not just extract it and then walk away. Especially the meal. I would say the meal is even more important. So I have our council meetings monthly and we order a meal. But even when I run focus groups and bring up, say, drop-in folks, I usually try to have some snacks there, make it a little fun, right? And then, so there's always that connection part over some type of a drink or a meal or a snack. And then they always know they're going to get a gift card. Asylum can't give cash. Our council members do get a check, but that's just a little different, right? And then after a certain amount, it is taxable, sadly. So we don't want to do that to our folks in the shelter, right? Yeah. So, but if you ever want to connect, I can let you know how I started my council. Well, not mine, but Siloam's council. But I'm very proud to have started this role.
Hi, my name is Brett, and I coordinate a drug user group that does work in activism as well as service provision. I was wondering about tokenism. Do you have any stories of seeing tokenism happening and resisting it? And any success stories?
Sadly, I do. So I'll just speak to when I was in this role, or working for Siloam. Yes, I was in this role. So I've had a few roles with Siloam, but so I was in this role. I was invited to a working group as a lived expert. I went to such working group and I shared my knowledge. Fast forward a few months later. So it wasn't right away there was tokenism noted, but as soon as they were devalued my lived knowledge and were like, no, you're just a Siloam employee, to me that felt like tokenism. And so I just exited and chose not to go back. I'm still happy with that decision. I can't think, not through Siloam, so I can't think of any. They've done this really well. They took a lot of time. What I can share, what I do know, is the past CEO took a lot of time coming to conferences like this, figuring out what it would look like to have lived experience in Siloam before they even hired me. So I feel like they worked on it for a good year before they even posted the job posting. There was a lot of thought put into it. It wasn't just, hey, let's hire this person and here, have at her. But yeah, so I guess just being very mindful. I'm trying to think of some more examples. I don't do it a lot, so it's hard for me. I don't do it, right? So maybe just say people want lived knowledge from their own shelter and they go down to, say you have a drop-in and they're walking around with a clipboard taking information, but not honoring those people in a good way or taking them to a private space or even asking if they want to give their knowledge, that's tokenism. So just doing it in a good way. So when I go out to seek the information from folks in drop-in or on the streets or wherever, I let them know who I am, what I'm doing, why I'm doing it, and what they could receive if they want to even join, and then it's completely their choice. Also, a good thing to note, what I tell people first is you can leave at any point. You're still going to get your honorarium. I don't care if you only answer one question, because again, that's their choice what and how much knowledge they want to share, especially when it comes to lived experience, because it's your own identified knowledge.
Hello, thank you for your presentations. I have a question about aftercare, after people share their vulnerable stories. So I worked on a project briefly during a year off in university where it was focused on rural and northern migration and homelessness. And they had sort of a star case study. And he, opened every community engagement, shared his story, did a documentary, but in the end, when the funding ran out, he was just discarded. So that's something I think I just want to bring up when we're talking about lived experience. Yeah. And so what kind of best practices do you have, both of you, in terms of providing that aftercare?
I'll let you go first.
Regards to aftercare, all the people that we interviewed, we invited to join the CDAC. So we invited them to join our group. And 3 out of the 7 people joined. And that was great. And I made contact with the other people afterwards, if they wanted to talk about anything. I think they had their own support networks, or maybe they just weren't comfortable continuing sharing. But yeah, I think making that offer is essential in regards to aftercare.
Yeah, and I think for ourselves, like I said, so for the council, they were identified as wanting to be a part of the Lived Experience Council, and they made that choice to join. And so aftercare, so like I said, like I have a cell phone, I have email, and I have my office right in the PSA area, meaning people can walk in and come see me when I'm there to get that support. I can often connect them with whatever type of support they're needing, whether that's elder, pastoral care, what other further support they may need. I also am able to provide that care, I'm able to just do it in an authentic way. For our community members, it's the same thing. So I think for myself, I experienced homelessness within Siloam Mission as well, and within Main Street Project and your organization. So I was a community member within that sector. So when community sees me, they already know a lot of my story, and the ones that don't, I share. I don't know, I just have an open door policy, I guess, and I'm able to support them. Funding, going back to your funding question, I don't see Siloam running out of funding for this role. I think it's going to be a forever role. And as for our council members, they can serve up to 3 terms. Each term is 3 years, meaning they could be on the council for up to 9 years, take a year break, and then maybe come back if there's room. Yeah, so I understand that sounds very sad, and I would hate for after exposing my entire story and supports for me just to be chucked aside, but I don't see that happening at Siloam, so it's never even crossed my mind.
We'll take the last question now.
That feels like a lot of pressure. So I had a question about lived experience and specifically how it relates to academia for both of you, and how to avoid tokenism. I'm here with a group it's a grassroots initiative from the Crab Park former encampment of Tent City residents. It's a warming bus initiative, and we're from the downtown east side of Vancouver, and it's an over-researched area. We deal with a lot of researchers constantly, a lot of honoraria, and it's hard not to notice that we end up with a lot of folks who work there for a little bit or come do research and leave with a degree. And the folks who participated in their studies or their research don't really get the same accreditation or don't, they're research participants, they're involved, but not to the same extent. And I was wondering if you had specific experiences with that or recommendations, because it sounds like incorporating people into the research and doing the coding, that's a big part of it.
So I think just like making sure they're co-authors of these reports, right? So I'm not sure if they're co-authors in your report, but for me, that's what I would make sure of. I'm not a researcher, but so I should put that out there. I guess. I've never went to school for research. I'm sure I am doing obviously some research, but just co-designing. So for myself as a lived expert, I did sit on a project with a university student and a former employee. And I was a co-author, and it's in there that I'm a co-author of that research project. And it'll be there forever.
Have you had any specific experience, because that was something we talked about in our group of like asking for, demanding co-authorship on things, but also losing research opportunities to participate in them, because a lot of the times they'll be thanked broadly in like the notes, but not as a co-author. Have you had success with that? Or Matt specifically, like have you seen good examples of that?
All the people in the CDAC are co-authors on the paper. They were named on the first slide. But that's really important. And just to your point about like accreditation. It's like, I'm a person with lived experience of homelessness, but I'm the only one out of the CDAC members, the Toronto group included, that got my master's. And it's like we need more people. Like we need more people trained, like in this kind of important research to be able to kind of bridge the gap between these two worlds, I would say. And yeah, we need like more formal training, I think, for this population to be able to better engage with the research.
Yeah, so anytime there's training opportunities, I always share it with my council members and whoever from community I can invite. I don't know. I hope that answered your question. Yeah.
Okay.
As for researchers going there and doing that, though, I don't agree with that. But how to stop them, I don't know. Go out there and tell them, hurry along? I don't know.
Yeah.
Sorry.
Thank you very much, everyone. So with this, we've come to the end of this session. We want to thank our presenters very much, Monica and Matt, for sharing your lived experiences with us. And to the participants, I want to say a big thank you as well for making it very interactive and interesting. I've learned one thing or two today. Thank you.